let's talk about the Ecuadorian healthcare market. First of all, they just recently were awarded by the UN a recognition as being one of the most innovative healthcare providers in the world. And in Latin America, they're considered one of the top 5 markets in terms of how they provide healthcare to everybody. So we're looking at a really sophisticated market in terms of, especially when you consider how much per capita they're actually paying per patient. Demographics, 16.5 million people, very similar to what you're going to see in a lot of Western countries. Not too old, not too young. About 60% urban, about 5% malnutrition, about 20% obesity. So I look at this as really one of those markets. It's not a really poor market, not a really rich market, right there in the middle. Per capita GDP is about $12K. Spending per capita on healthcare is about $350. And they have a very innovative but very Latin American system. So we have the Ministry of Health, which is committed by law to provide healthcare to everybody. We have the Social Security, which, like the Social Security in Mexico and a lot of other Latin American countries, people pay into. In Ecuador, it also covers government employees, it also covers the military, and that's really, it's considered such a good level of health care that a lot of the expats actually use the Social Security instead of using private sector. And then we also have the private sector, which includes medical tourism. And that includes some really, really good hospitals. Maybe not at the level of what you're going to see in Colombia, but very close. So we have a very nice mix of different levels. Every village, essentially every person, you could say, in Ecuador has a healthcare professional assigned to support and help them out. So every village has people. A lot of these people are, say, midwife level, and they're going to go out and provide the healthcare support. 2 doctors per 1,000 population, 1 hospital bed. Interesting thing, the medical schools are obligated now by law to have 50% female students, so they're pushing towards encouraging women more into the healthcare sector. What can you sell here? Well, here's the thing. Anything, because if you think about the decentralized system, right, anything that's going to provide healthcare in villages, anything that's going to provide telemedicine, anything that's going to provide better training for nurses or midwives who are dealing with patients far from the cities, things that deal with sanitation and clean water. But then in the cities, you're going to have everything that you're going to find in other markets with a per capita GDP of about 12K, right? You're going to need all that good medical equipment for hospitals, the diagnostic equipment, the beds, the ventilators, all that type of stuff, as well as medicines and so on. The population here hasn't really fallen into the serious lifestyle problems that some other richer countries have, but let's see, in 20 years, the GDP is growing at about 4.5% a year. I'll tell you what, over the years, I've been coming here for years, more and more building, beautiful new airport, beautiful new buildings. The economy is booming. People will be having lifestyle issues in the next decade. Remember, when you're ready to grow your international sales, reach out to us. We can help.
When you decide it's time to grow your international sales, call us.